Welcome to Heart-Based Medicine's Heart of Healthcare podcast, featuring Dr. Kavitha Chinnaiyan. Understanding the heart of wellness.
Hey everyone, welcome to this session of Heart of Healthcare Live. And today, this is a very beautiful possibility. We have a fantastic guest with us that I'm really proud to announce and really it's like meeting friends. And I'd really like to introduce you to Kavitha Chinnaiyan. And she is a professor, and she is a professor of cardiology and a professor of medicine. And she is not only working as a cardiologist in a hospital, as we all know it, with all the environment that we all know, in a classic healthcare setting. But she is also the author of several books. And I would like to mention here the Heart of Wellness in particular. And today's conversation to me is particularly precious because there are only very few people that I'm blessed to meet who can bring together ciencia and consciencia, so science and consciousness. And those of you who have the luxury of already knowing Kavitha or having heard about Kavitha, you will already appreciate the depth of her sharing. And we would like to explore today with you what it means to actually live in a world that provides healthcare in the allopathic classic training as it is taught in universities, and what it means to kind of align this with our inner purpose, and what it means to live and thrive in such a system so that we can show up as the best version of ourselves. So welcome, Kavitha, to this call.
Thank you. Thank you so much, Jan. You are absolutely amazing, and it's an honor for me to know you and to be here with you.
Thank you. So Kavitha, and we've already talked about this many times and we've kind of taken different angles. And today we were looking at training, and we wanted to explore what is it that it would take if we had the opportunity to change the way that we train medical students. Mm-hmm. And also, what would it take for us who have been to medical school quite some time ago and have been kind of on the road for a while, yeah, but we're still in a process of learning in many ways. Mm-hmm. So what might it take to change our training, whether as a student or as a senior physician? Yeah. What might it take so that we are supported to bring consciousness mm-hmm. into our practice?
Yeah, that's such a great question. And, and I think, the thing here is the problem here is of fissuring. It's a splitting off of really why we come into medicine in the first place. Most of us who come into medicine and to become doctors or healthcare providers, it's because we are moved by this consciousness, so to speak. We are moved to explore this very deep human connection in a very particular way. I mean, that is the purpose, of all of us, no matter which field we choose. But in medicine, what happens is we come to it because we want to connect with other human beings at this very deep level, which is through their illness and through their wellness and through the phases of their life that, our patients go through. But then when we come into medical training, what happens is we, in Western medicine, we have really sold our soul, so to speak, to evidence-based medicine, where everything is about data. It is really about what works for this disease. And so it becomes really disease specific, which means it is body specific. When we are talking about you or me in medicine, we are essentially talking about either your disease or your body parts, your organ systems, or particular systems within that. And if we were to talk about your mind, it would be only in relation to how you are perceiving your illness, right? And that's it. That's where it ends, right? So this conflict we tend to have later, as we start with our careers and kind of go about our careers, is that purpose for which we were kind of drawn to medicine. It gets kind of buried under the layers and layers of this, this drive to be very specific about treatments and therapies and things, which trial has shown what, and we remain there, and so we get really good at the science of medicine. We are even good at the art of medicine because we have to cultivate a bedside manner. We have to cultivate relationships. But the fissuring happens because, fundamentally we want something. It's that deep spiritual connection with the other. I'm calling it spiritual, not from any religious standpoint or anything like that. It is this connection that what you are is no different than what I am. At the most basic fundamental level, at the level of consciousness, you and I are the same. It is me talking to myself, is me talking to you. But that remains unexplored. That is the thing that we come to it for, but that remains unexplored in the noise of everything else. Because, in these countries, for instance, in the US, you also practice under the fear of litigation, right? That if you don't do things well, you can be sued. You don't want to go there, right? So you kind of bind yourself. And so that fundamental thing remains unexplored, remains kind of buried, and that dissatisfaction continues. And that is, I think, in my opinion, a big reason for also physician burnout, because you aren't really, the juice is drying up.
That's beautiful. Yeah, it is unexplored within our profession. I mean, there are some domains,
yes,
in which this is actually really well explored.
Yeah,
there are traditions, there are healing traditions, there are religious traditions, there are spiritual traditions in different realms where this has been studied very closely. But the scientific process used is a different one. The process of exploration is not the one that meets the criteria of what we would call scientific method today in the Western world.
Yes, absolutely.
So there's a lot of value, obviously, to go down that scientific method as we have it in the Western world, as what is taught in medicine and medical schools.
Yeah.
Yet, as you said, it's kind of limiting this, and we haven't explored this part from the science point of view. Yet everybody knows it. Isn't that the case? I mean, I don't know about your environment. Whenever I talk to a colleague, everybody says, yeah, I know what you're talking about, but it's like, we can't really talk about this in public, right? So yes. These things are talked about in small groups, but not openly. Is that similar in your environment?
Absolutely, because these things are soft. They're not hard, evidence-based things that can be measured objectively. And the other thing that happens when you talk about this, the application of this in medical care, for instance, right? The application of I'll just loosely term it as the mind-body therapies, right? Which could be consciousness based, as in why don't we explore something deeper in you, right? The problem happens, even when you look at, trials or studies that have looked at the application of yoga or whatever it may be, meditation or whatever. We are so so deeply conditioned as scientists, in the physician community, to look at these studies and say, okay, if you do that, what's the benefit going to be on whatever, on your blood pressure, on your mortality, on your disease process? So we are so used to looking at things objectively and in measurable ways. But you see, this consciousness that you're talking about is not measurable, because it's not a thing that can be measured. It is the subjective experience of life that changes with the cultivation of this. And there is no measure for that. And in fact, it may have absolutely no effect on your disease whatsoever, but something has changed in you, right? And that subjectivity is something that because we can't lay a finger on it, it becomes dismissed. It doesn't exist. Yeah. So
which is understandable. If I'm a researcher, I'm always kind of a little bit scared of big questions that I can't really solve. They feel like daunting. It's like, I can't really get to that. So I'd rather, let me have a question that I can dare to answer. Okay, let me have a question that's simple enough, a trial design that's simple enough that I feel like, okay, maybe this tiny little question I can actually have clarity on.
Yes.
So this is understandable as a process with a really long-term vision.
Yeah.
But I guess what I understand from you when I listen to you is that's kind of one way of traveling.
Mm-hmm.
And we could actually say, why don't we have just have this image in Switzerland? There's this huge mountain, Gotthard, okay, and they at some point they plan to have a tunnel through that huge mountain, very long tunnel. And so one team was starting from Switzerland and one team was starting from the Italian side, if you like, okay? So the idea is, can they actually meet? so what I hear you is, can we explore, can we kind of widen the scientific process by saying, yes, evidence-based science is fabulous.
Yes.
And we're coming from, our work is based on the paradigm of brain and matter is kind of the starting point and is the seeding point, the source of action and speech.
Yes.
And at the same time, we'll have another team starting from the consciousness point of view, saying like, okay, based on the assumption that consciousness is, or the unifying field is what exists, and then matter emerges from that, we're actually starting from this point of view, and then see where's the overlap, where's the meeting point.
Yeah, exactly. And when it comes to training, which is to go back to your original question,
Mm-hmm.
it is to present these possibilities.
Mm-hmm.
That's the first step.
Mm-hmm.
That maybe there's something more to this than meets the eye.
Mm-hmm.
And asking questions that there are no answers for instance,
Mm-hmm.
right? And I remember when I was in high school, and we were studying embryology, I was really fascinated. I mean, in medicine, and all of medicine, I feel there's nothing more miraculous than embryology,
Yes.
right? It just, if that doesn't move you, then
what?
What, right? So I was fascinated, and this is what really started my whole quest: is how does this one cell, fertilized cell, undifferentiated cell, know to differentiate into all of these different organs? What is that driving force, right? And so you can say, well, DNA. Yeah, but how does the DNA know, how to meet up, the base pairs? How does that happen? Where is that intelligence? What is that, the source of that intelligence, right? And so you keep going back, asking these questions until you arrive at this place where I don't know. I don't know. And that mysterious place, if we can go there and have that be our inspiration, it will always be awe-inspiring, right? That place of not knowing. Because when you're in that place of not knowing, you can't be cynical.
So let me ask you, you're a professor, you're training residents, you're training students, you're part of the body that represents Western medicine and teaches that.
Yes, and I also publish papers and trial
Exactly.
studies.
So that's all part of this game.
Yes.
And at the same time, I guess that in a way, because of your own, not just your own curiosity, your scientific mind, but also actually being ready to open your mind and heart to the degree that you're allowing to experience a vastness or a consciousness that is beyond the deductive Cartesian world model.
Yeah.
I guess this somehow sneaks into your student teaching.
Mm-hmm. It does.
Are you willing to share some of this? So basically, what do you see? What are ways, or how do you see possibilities to inspire this curiosity that goes beyond what we call the scientific method, that actually kind of is a little bit outside that frame?
Yeah. And this happens in the day-to-day clinical teaching, for instance. If I'm seeing patients in clinic and there are, residents and fellows seeing patients with me, then it is really, that the way that you connect with that subject and you connect with that patient, or you connect with the disease itself, the process, and you demonstrate an interest that goes beyond, okay, what do we need to do for this? It's like, why is this happening in the first place? I mean, what is this beyond the pathophysiology? Can we talk about that?
Mm-hmm.
What's causing this? And the more you demonstrate that curiosity and excitement and the awe, of it all, it's like, how does one rogue cell become a cancer, right? I mean, that's fascinating, right? How does that happen? And so remaining in that awe is something that can't be taught in so many words as it's a stance that, becomes absorbed when other people are working with you. Because, and also it's not that, students and residents and fellows appreciate that, because a lot of them are already conditioned to be cynical. So for some of them, it may be just, what is she talking about? Let's move on, right? Yeah, it can be that too.
You mentioned the cynicism, the learned cynicism before.
Yeah.
So what happens there? So that's kind of really a key thing that comes into the way.
Yeah.
What happens there?
It's like, you have lost the ability to wonder. That is cynicism. The wonder that medicine held for you, it somehow, somewhere changes into, a little bit of familiarity, a little bit of contempt, a little bit of resentment, a little bit of, because it's hard work. And then we have so many things that are not in our control, such as what is set, the standards that are set by insurance payers, hospital administrators. All of that contributes to this, the cynicism. It's like, and not being appreciated, and this fear of litigation. All of this adds to this, cynicism, where that wonder that brought us to medicine kind of, again, gets suppressed because of all these very practical issues.
So given that this curiosity or this wondering isn't really, or may not necessarily be taught in medical school, or let's say it's not structurally taught, but it kind of depends on whether you're lucky to have a teacher that is kind of, it's depending on an individual to actually inspire this in students.
Right.
And probably even more so during residency, where kind of there's long hours and it's kind of a bit of a survival phase of the training.
Yeah.
Where do you have an attending? Do you have a supervisor that really kind of takes you into this exploration and kind of kindles the flame, or doesn't?
Yeah.
why is it left? Why do we as a healthcare system, as a faculty at the university, why do we kind of leave it to the individual? That's kind of the law. When I look at the various faculties that I looked at, or that I talked to, university faculties, it's kind of the, this is the content, this is the syllabus, this is what students need to learn, this is what we check in the multiple choice test, and then the rest is kind of, it may happen or it may not.
Yeah.
Why is it not given that every senior actually knows about the value? Why is it not taught?
Yeah. I think this is it's much broader than medicine, and this is what we were talking about earlier, is it's how, so one thing that has been shown in many studies actually is that physician implicit bias, for instance, is a real thing.
Mm-hmm.
It's real, right? So whatever we have, whatever our outlook is, as that has been shaped by our childhood and by the society and our peers and our parents and our upbringing, is what we bring to medicine. It's not like, because by the time we come to medicine, that part of our developmental psychology, that is done. It takes a lot of conscious effort to continue to shape ourselves beyond, the adolescent years, right? And so how we come to the training of medicine is going to determine how we are going to practice medicine. As whatever has, the biases, the concepts, and the things that we have within ourselves, our religious beliefs, our spiritual beliefs, whatever it is that has shaped us. Mm-hmm. It's not that we can't continue to change. Of course we do throughout our lives, but that thing that has happened early in life remains really very strong. And so if we were to talk about bringing in, consciousness, for instance, into training or into the practice of medicine, that has to become the default of society, right? Because it's going to have to be how we raise our children. And for that, we have to, if we have to raise our children in a certain way, we as parents have to, first of all, have some, experience of that, right? So it's more of whatever happens on a societal level is reflected in the medical field. Like, for instance, the racial bias and gender bias and all these things that happen in society are reflected in medicine, in how we provide care for our patients.
Yeah.
So
what if, so is there a way for the healing profession? Is there a way for healthcare professionals to actually take a stand here? Because we are in this very peculiar situation of, living a life as an authentic human being and having to deal with all of with everything that comes with it, and coming to terms with our own lives and our own stories and our own, experiences on this planet.
Yeah.
And then actually meeting professionally with other human beings who, live their authentic lives. And so we actually get to meet, yet our role is to kind of provide a space that is authentic enough so that they feel this is a trusted healing space.
Yeah.
So is this, if you like, one-on-one healing encounter, could this be like a model or a case study, if you like, if we understand this relation really well? To what degree can we understand it better so that it actually serves as a role model for a societal shift?
Yeah, and that could happen, but again, the thing here is there has to be a willingness and a wanting on the part of the physician with regard to this kind of an outlook. As with everything, we have to want it. because this, the realization, for instance, of that my deepest truth is not my story, it's not my body, it's not my mind. What I am is beyond all this. And for this realization comes spontaneously to many, but more often than not, it's not a spontaneous thing that happens. You have to want it. You have to seek it. And so it is in the medical field too. If physicians are, for instance, ambitious physician scientists, or they're very clear about what they want in life. They want to achieve this, they want to do this, they want to do it this way. They're not interested in all this, so you can't push it on them, right? Because you have to want it. So and how can we do that, right? We can't make anyone want anything that they want. And for me, coming from my interest in these ancient traditions, is that is the gift of grace. To want that is really grace. And it happens whenever it happens. So and when it does, then that interaction, even in an encounter with a patient, for instance, and I have seen this so many times in my own medical practice. It's the same patient I've seen for years who does not want to change, doesn't want to do anything different, and then bam, one day something is different. They're like, tell me what I need to do, I'll do anything. And then grace has descended, right? And then the communication, the way I connect with that person is entirely different, even though we've known each other for years, right? And that is it's an extraordinary connection, because now we're in the same place, And so I think here is where the humility comes in, that there are a lot of things that are beyond our control.
Yes. And well, so I guess everybody in healthcare, I think, can really relate to this moment that you're referring to, when you suddenly feel there's a therapeutic alliance that is beyond the role we play, that is much deeper than that, and then things start shifting at a different level of quality.
Yes, absolutely.
And if this patient that you're describing met the scientist who might not have opened himself up for receiving the call that you described, there might still be a misfit.
Yes, absolutely. Because the patient is at a different place, but we haven't grown to that place, So it happens both ways, right?
So isn't there like so it almost sounds like, as a healthcare professional, we need to make a decision here. It's a choice where we're saying, okay, I'm willing to meet those who are interested in the currently available science. I'm willing to help those who are willing to accept the limitations of this process. And not everybody agrees that this is a limited process and it goes as far as it goes.
Yeah.
Or am I willing to absorb what can be absorbed from this limited process? And I'm ready to open myself to something unknown, to an uncharted territory, to insights that may evolve at that very moment that you've just described, where I don't know the answer, the I don't know, and the curiosity that then comes in. So here's somebody asking for help, here's somebody actually not knowing. And in this shared space of not knowing, we'll actually see what emerges through the joint, through this therapeutic alliance.
Yes, absolutely. And it so happens that, and I've seen this a lot, is something happens to us around, in our middle age. Because, we come to this point and then suddenly we realize, life is limited, that our time is limited, that, okay, I've accomplished so much, but then have I really? Is there more to life? And, it is when that kind of questioning begins that big things happen, big shifts happen. And then, we are okay with becoming of that tunnel you were talking about. We're okay with accepting both of that and exploring it for ourselves and saying, okay, this may be the case, but where am I? And what do I need to do?
Mm-hmm.
So, and again, that's the play of grace.
So if somebody feels at the brink of that, so somebody has that hunch, somebody has that notion of, I'm missing something, or I've lost something, but somehow I'm not actually expressing the that I could.
Usually what happens is, you just go buy a Ferrari.
Yeah,
or
exactly.
you go on vacation.
Right?
You go on vacation,
Yeah.
or you start a new relationship, or you do something like that.
Right.
Because we don't know where to look. When that sense of dissatisfaction comes up, which is really the driving force for all 7+ billion of us, when that sense of dissatisfaction comes up, the question is, where do we look for it?
Yes.
Because we are always looking for satisfaction in things outside of us, whereas that's the wrong place to look. It should be within us, because that's the only place where we can find completion.
Yes. So this journey, I would love to see as part of medical training to be offered, just as much as I was offered by the histology classes to admire the miraculous expression of cells and tissues.
Yes.
And just as I was offered a physics equation explaining the flow, the resistance of flow through a tube that leads to the okay, now I understand this breathing and obstructive and not and restrictive, and okay, now I understand the cardiovascular system. Okay, this is so these aha moments that we get through knowledge that is delivered.
Yeah.
Now we're talking about a different mechanism. Now we're not talking about knowledge. Now it's kind of more experiential.
Yes.
So do you see that this is something that we could actually include in medical training or part of residency, maybe at a later stage? Or could you see that?
Yes. In fact, I feel that, and I have teenage daughters, and I tell them, in college, if there are 3 things, I would recommend you take. One is quantum physics.
Yep.
And everybody can benefit from really studying quantum physics, right?
Yeah.
And the other is psychology, developmental psychology.
Yeah.
And really study that. And the third is the fundamentals of the ancient religions and the ancient traditions.
Yeah.
In fact, any tradition, right? If you look at the fundamental thing of any tradition, any spiritual tradition, any religious tradition, don't go into the religious aspect of it, the institutionalized part of it, but look at the fundamental aspect of it, and then you will learn a lot more about yourself. And I think if we can teach this, and Ayurveda is the medical science that I'm also trained in. This is why I like Ayurveda so much, because it gave me what modern medicine wasn't giving, and that is this holistic view of where we fit into the whole scheme of things, and what is wellness really, what is health, and from which broad standpoint can we look at health and disease. And so Ayurveda starts with this fundamental thing, how you have come to be, how the universe has come to be. It starts as consciousness, and matter it comes from consciousness. And so teaching those kinds of things, and a lot of medical schools are doing that actually. And I give a talk every year at our medical school on Ayurvedic, the fundamentals of Ayurveda. And you should see these medical students in their eyes just open wide and they light up, a lot of them. It's like, what? This doesn't even make sense. What do you mean we came from consciousness, right? So I think that kind of training really at least gives you the possibility that there's something more than maybe your limited mind worldview.
Yeah, and it could be, could it be taught as as part of a scientific process? If we, as you're saying, this is a subject that may lend itself to some ology or osophy.
Yeah.
if we actually do not want to go down that route,
yeah,
if we actually want to not end up in another mental framework around this,
yes,
but could we keep it like a scientific hypothesis, if you like, for the next generation of students,
mm-hmm.
where we're saying, okay, so here's something for you to explore. And it's not about whether, the world started with some DNA by chance reassembling itself,
yeah.
or whether there's some god sitting on a cloud with a big white beard, or wherever you're coming from, or there's a whole host of gods doing some magic things.
Yeah.
We don't even need to go there. But if sort of just ask the question for scientific pursuit. And this scientific pursuit could be following the scientific method as we know about it in Western, if you like, philosophy of science. But it could also be an individual subjective exploration.
Yeah, exactly. And for that, it needs to be taught with, really concrete techniques and methods. You can't just, ask somebody, here, go explore yourself. Nobody knows what that is, right? There has to be a methodology to it. There has to be various steps. You start with this, and then, as depending on the individual proclivities, you do the next thing, and you do the next thing. And that is really how the spiritual traditions have it all designed. And if that could be brought in with a very, simple, practical way of putting things into practice, of even how to explore yourself, I think that would go a long way.
Wow, that's amazing. That sounds like that sounds almost like you would be ready to develop a little training course or syllabus, bringing consciousness and science together, ciencia and consciencia together, and see how can we actually make them meet in our profession, as it not just as a spiritual exploration, but actually a very concrete, very tangible, walking through in the morning, getting up, getting ready for the day, preparing for the day, walking through the door, the main gate of the hospital, and actually, following our professional pursuit. Yeah,
exactly.
Wow, amazing. Okay, so here, I guess we can almost. Should we do that? Yeah, I think we should do that. I think we should call for our colleagues. I think let's put out a call for our colleagues here. Whoever is willing and ready to join a group of physicians who feel that need and have explored this route, and would be willing to see what is it that it takes so that we can bring consciousness as a possibility into our healing practices, and see how we can explore this together and how we can build methods in integrating this in our daily life.
Yeah.
Oh,
that's
beautiful.
Great.
Okay. So 2 people on the faculty. Who's going?
That's hilarious.
Well, thank you so much. And if you're a student, or if you're a resident and you want to meet a teacher inspiring and teaching awe and bringing heart into medicine, here's Professor Chinnaiyan for you. Thank you so much for taking the time, Kavitha.
Thank you. Thank you so much for having me.
Great pleasure. Thank you.
This has been a Heart-Based Medicine production. Thanks for listening.